Hi everybody, this is Venk with Always On EM. I'm at ACEP in Las Vegas. I'm really excited to hear from Rachel and hear about her work. Rachel, thanks so much for taking the time. Can you tell us about who you are and then introduce us to your work here today?
Sure, yes, thanks. So my name is Rachel. I'm a research assistant professor at the University of Colorado, Department of Emergency Medicine. I'm also a forensic nurse at the University of Colorado Hospital. And I'm here today to present some of our data from this forensic program since 2018 to 2022, looking at trends during and after COVID on how patients were affected in terms of interpersonal violence. If you're unfamiliar with what a forensic nurse does, you may have heard of a sexual assault nurse examiner. We're similar, but essentially we have a broader umbrella scope of work that we work with. So any patient that comes into the emergency department and reports any kind of interpersonal violence, it could be sexual violence, physical, it could also be different types of domestic violence, such as intimate partner violence, child abuse, elder abuse, anything of that nature. So we see a wide variety. We're about 8 minutes from the airport, so we also see people from all over the country. In terms of what we found, so I submitted this before we had the 2023 data in there, unfortunately, but we did see some considerable changes in terms of our patient demographic and the types of violence they were reporting. Interestingly, and probably not surprisingly, the lockdowns caused dips and changes in our patient volumes. But what we were interested to find was that it also changed the severity of the type of violence that people were reporting, as well as changes in things like we saw decreases in the overall volume of sexual assault, but the severity of symptoms was higher, as well as the number of drug-facilitated assaults. So we saw some really interesting trends, kind of hard to unpack in one poster. But all this to say that it really underscores the value of having a specialty service or nurses or even just an interdisciplinary team that can really champion screening patients for violence, making sure that they have the care that they need, and recognizing that COVID really did have an impact, but really what we're seeing is it's started to increase and continue to increase the amount of violence and the severity of violence that we are seeing in the hospital.
Wow, I'm really glad you're doing this work. Do you mind taking us through some more of your results in more detail?
Sure. So we had a little over 4,800 patients between 2018 and 2022. A vast majority of our patients are female, and the average age is about 35. Every year, the number of patients increased by several hundred. This past year, in 2023, which is not represented here, but we had over 2,300 patients. So we had a couple 100% increase in our patient volume, and that has continued to increase. In terms of the actual results here, so the vast majority of our patients report sexual assault. That is the number one thing that we see patients for. In terms of COVID, we saw that there was actually decreased odds of people coming in for sexual assault during and after COVID. That number has started to increase now about 2 years later. And then in terms of the number of drug-facilitated sexual assaults actually doubled. In terms of intimate partner violence, very similar to sexual assault, we saw decreases and dips in the number of patients that were coming to the emergency department specifically reporting intimate partner violence, but the severity within which was much higher. In fact, I believe it was 2.4 times higher in terms of their risk of death in their relationship. And we use a validated measure called the danger assessment, which looks at various factors within a relationship. And so overall, our numbers were much higher and have continued to be increasingly high, meaning that most of the patients that we see are at an acute risk of severe or lethal injury. In terms of physical assault, we saw again dips during lockdowns in terms of the number of patients that were coming in for concussions, strangulations, stabbings, gunshot wounds. However, the severity of those incidences was much higher. So the number of strangulations, for example, we typically see at least 1 or 2 reported strangulations. We were seeing upwards of 4 or 5 per patient. So it might not have happened as frequently, or people may not have been coming in as often for it, but when it did happen or when it was severe, they were coming in and their symptoms were very concerning. And so that's a little bit of a nutshell. Does that explain it for you, or is there more I can go into?
That was very helpful, Rachel. Thank you so much. And I'm really glad you're doing the work. It's unfortunate we need it, but really, really helpful work. And I hope you have a great time here in Vegas. Thank you so much for doing this, and thank you for you and your whole team.
Thank you.